actually.
So this is pretty good. He's a 22-year-old healthy guy, and he's been told he's got arthritis. Does that even make sense? It doesn't make sense. But to an average person, you start to believe that. You're like, okay, I guess I have arthritis.
Yeah.
Yeah. So, but that's a big fat lie. Arthritis doesn't kick in until you're older.
Oh, that's good news.
Yeah. So he's here. He's here for resolution. He's here to get better. Not just better, but he's here to get this thing fixed. So we're hoping to find the source of that problem today. We're going to take some X-rays, full spine X-rays, and hopefully fix them.
Yep.
All right. Let's go take some pictures.
Sounds good.
Come with me. So Antonio has been, I think, to 3 different providers where they've taken X-rays on 3 separate occasions, but he's never seen his X-ray. So if you don't know what's going on, then you probably will not make changes to your posture, to your lifestyle. So we're going to be taking a look at his X-rays to see why he has this pressure coming from the neck going to the shoulders. So this is the first X-ray we took with the mouth open. We're looking at the head slightly being tilted. When we see the X-ray from the side, it actually shows his head being really forward in comparison to his trunk. So this is his upper back, this is the neck. So we'd like the curvature to be more further back, around here, where you can see his head is really forward. That's an anterior head carriage, we call. Here we're looking at the upper back. And we are going to also take a look at the upper back from the side, where you can see an extra kyphosis in his mid back. That's too much curvature. But the main thing is this X-ray. This is the lower back and the hips. So if we're just looking at the problem area, which is the neck and the shoulders, and if that problem is because of the compensation from the lower back, then we can do all the adjustments up there and make no changes because the foundation is basically the problem. In this case, you can see how his hips are slightly higher on, his hip is slightly higher on that left side, and his curvature is kind of going sideways. All right, so it's not coming back up straight, but it goes this way, and that usually carries on all the way up to the neck. That's why we also see his neck not being where it's supposed to be. Doing a little close up here makes us understand that his spine has a congenital anomaly. Here we have a spina bifida there. We also see that this side, which is the right side, his transverse process is open, and this side it's closed up and it's completely fused with the sacrum. So we have one big huge block here, which is L5 being fused on the left side and the right side being open. Let's take a look at it from the side. Here's a side view. Let's go back here. We're going to count 1, 2, 3, 4, 5. So he does have 5 vertebrae, but that 5th one is fused with the sacrum, which is right here. So if we do a little bit of a close-up, we can see that this is all one piece. They all will move together. L4 up here seems slightly posterior, right there, and if we measure it, you can see that's L4, here's L5. So there's definitely some pressure coming from L4. We'll scope that later to see if the pressure's there, or is it coming from elsewhere. All right, so let's get to work and get a scan. I'm gonna have you sit over here. All right, so I'm gonna start up here. Pressure at C6 at the base of the neck. Let's do that again. Right there, picks up at 6. Let's use a different scope to also confirm. We get a big spike there. Number 6. Let's check the rest. Let's bring this up. You can tuck your shirt out. We're going to bring it up here. We're getting a reading here at number 5, T5. And a reading at L4. Let's check the sacrum. Nothing there. Right there. Okay. So go ahead and stand up. I'm going to leave this up to check the movement. Now to get it from back here, I want to see if you can get that line. Let's see if that line is moving. Lean to the right. Okay, getting a nice curve there. Go to the left. Way better curve. Go to the right. A little bit less, more fixation on the right, but nothing too crazy. Now, I'm going to have you bend this knee and then bring that leg up. Go ahead and bring the leg up on the right. Higher, higher. Okay, we're seeing movement. You can put it down. Let's see the other one. We also see movement there. Okay, that looks good. Here's number 5, and here's number 4. Any pressure on 4 when I push on 4?
A little bit.
A little bit of pressure there. Okay, so we go back to the x-ray to see how you're going to set 4. Let's start with that first adjustment. So let's draw a line. And number 4 and number 5. That's fused. So there's 4. There's 5. We can see that wedge is on that right side. So we're going to close the wedge on the right on this table. So let's go sideways, facing me. Go ahead, put your head on the pillow and face me this way. And this arm is right here. This one's out. Let's bend this leg. Here's 5. Here's 4. We're rolling over. This is not going to hurt. Nice and smooth. It's a pretty good deep adjustment. You can come up. So next I'd like to check that T4. Let's go back to the knee chest table. We'll check it over here. Come over here. So once your knees there, and then your face goes in here. So put your knees there, put your face in there, and grab the sides. That's good. Don't move your knees. They're great the way they are. Let's allow the abdomen to drop all the way down. There we go. And let's palpate that T4. So right in here. Is that sore?
Yeah, a little bit.
How about the one on top?
Yeah, still a little bit.
This one is more?
Yeah, more.
Okay. How about the one underneath?
Not as much as.
Not as much, right? So that T4 is the segment. So let's get a good movement there. You're nice and relaxed. You're breathing normal. I'm gonna give it a small push there. That felt pretty good.
Yeah.
All right, so now I'm gonna have you come up and sit back on the chair. There. And let's palpate all the cervical segments. So there's 6. Let me know if there's any pressure on this one.
A little bit.
A little bit. Now, how about when I go on 7? How's 7?
A lot more.
A lot more. Okay. So here's 6, here's 7. And how about when we go to T1, which is down here?
Yeah, a little bit.
A little bit, but you have most of it at 7, right?
Yeah, right there.
And here's 6. Now, let's go to 5. How's 5?
A little bit.
4?
Not as much.
3?
Not as much.
2?
A little bit there.
A little bit. But mainly 7, right?
Right.
So here's 5, here's 6, there's 7. And let's see how that 7 feels when we lean this way and this way. You ever crack your own neck?
I tried to, but no success.
Okay. Did you do it in the past?
Yeah, same, but
Were you more successful before,
I was.
cracking your neck?
Yeah, lately it hasn't been successful.
Lately, he hasn't been successful cracking his neck. So we are going to explain why he hasn't been successful. So you'll notice my contact with my left index finger is on the tip of that vertebrae, which is C7. I'm going to lean his head slightly to the left, trying not to extend it or twist it. The set is going to come from C7 into the C7 disc, straight through that disc. So I'm going to do a little push there, nice and loose. Okay, we have some movement, but it kind of feels like that segment is really stuck. I got movement, but I'm just not satisfied with it. So we're gonna try to get a good set on that level face down.
Okay.
I'm gonna have you here face down. And go ahead and drop your hands down on your side. 5, 6, 7. Let's bring the head up. All right, breathe in, exhale. Good. We got it all the way. Whoa, did you feel that one?
Yeah, definitely felt that one.
Yeah, it went deep. But you notice when I first did it here, it was like, okay.
It was being stubborn.
I mean, he moved,
Yeah.
but it didn't go all the way.
Right.
So the thing is, if you don't move the whole vertebrae, including the disc, then it's gonna kind of be like a relief. But if you move and shift that disc with the vertebrae, then that's the permanent change. So, all right, so sit back here. I'm gonna scope that again. So there's no more pressure down here. However, we're starting to see some pressure up there on the very top. So let's confirm that. Here's 7. But as we go up, right there on the very top, C2 has pressure. So let me check that C2 segment. And I'm gonna do some range of motion to see if that's sore. So here is C2. How does that feel?
A little tense.
Let's check that again. and a little tense, right?
Yeah.
Not too bad. Or you do actually feel pain.
Yeah, I feel it.
He feels it. So here moves, here it doesn't move. C2 is stuck on the right here. So I'm gonna try to do a C2 adjustment on the chair. If we can't get it, we're gonna do it face down again. So let's see how well that goes. Now we got it all the way. I needed the second push.
Yeah.
All right. Let's just massage it a little bit, and then we're going to rescope and see what's going on there. Yeah. So, but the idea here is, Antonio, to set it, check it, make sure the pressure is gone.
Mm-hmm.
If you're not checking it, if you have no way of knowing if that pressure is still there or not, then you can't say, okay, do I want to go back there or do I want to leave it alone? So let's go up, here's 7, going up to C2. That's C2 just cleared up. Okay. Okay, I like it. All right, good. And let's check the mobility up there. A lot looser. You can see that C2 moving nicely on both sides. All right, so why did this happen in the first place? Poor posture.
Okay.
So we'll talk a little bit. So what is normal posture? Ear over the shoulder, over the hips. So like this. So go and sit up straight. So you're lined up, just like if you're standing. You're not standing being slouched, you're standing straight. So
Right.
ear over the shoulder, over the hips. But because of all these years where your head's actually gone forward and your upper back is curved too much,
Okay.
your ear is in front of your shoulder.
Right.
It needs to go back this way. So basically it would be more like this, but I don't expect you to do that. That's just not going to be a natural.
Right.
So you have to be mindful of your posture when you're sitting. And you got to start doing some stretches to
Okay.
open up the upper back.
Okay.
It's really tight. Using the foam roller, going back into extension, and we'll go over that today.
Okay.
But I also wanted to tell you why you shouldn't crack your own neck. So I think that's part of the problem.
Okay.
So what did I do? I went on the bone with my index finger and I shifted the bone and I locked your whole head and I moved the one that needed to move.
Right.
But if I'm going like this, like this, like this, like this, am I isolating a level? No. I'm just cracking whatever that wants to move.
Yeah.
Now, what moves? Something that's stuck or something that's loose? Something that's loose.
Yeah.
Because the one that's stuck is going to stay stuck.
Right.
So what are you going to do eventually? You keep popping the segment that is normal, eventually it becomes loose.
Okay.
And eventually what happens that the ligaments that are holding things together, the anterior longitudinal ligament, the posterior longitudinal ligament, they kind of get worn out.
Right.
And then the head just drops.
Okay.
So you can't pop your neck. Why? Because you're not popping that needs to move.
Right.
You're popping something that's normal,
Okay.
or something that's loose. So you've got to start doing things that will open it up, laying on a foam roller, and just having a much better posture. And over time, I think you're going to see a huge change.
Okay.
So stand flat against the door, so that way you can find your center of gravity. Do you exercise?
Yes.
Okay. So when you're exercising, you want to be in the center of gravity. So that is ear over the shoulder, over the hips.
Right.
Like if you're doing some triceps right now, go ahead and give me some triceps. That's where your head has to be.
Okay.
If you're doing shoulders, this is where your head has to be.
Gotcha.
If you go to the gym and you start working out, being in this position, you're in trouble. So you do want to be in this center of gravity.
Gotcha.
But if you're walking, your head's there. If you're sitting, just like that, you maintain this. Does that make sense?
That does.
Okay. So any questions for me on our first visit?
No, I mean, I definitely feel a lot better, so that's good. It's a good sign.
Questions come, you can always call me.
Okay.
We're going to do a follow-up in about a week or two.
Okay.
See when you can come back. We're going to check these levels. I think this is gonna be a quick resolution. I don't think this is something that we're gonna be stuck with. It's mainly your posture that's gonna hopefully keep things together.
Okay. Sounds good.
Alright, week 2.
Thank you.
Alright.